Well, it has become one of the most divisive issues in our post-pandemic life, whether or not to impose another mask mandate.
LA County is once again floating the idea, and as you can imagine, reaction from both sides is very intense. KCAL 9 political reporter Tom Waite live in Porter Ranch. And Tom, what are you hearing?
Well, as you can imagine, and as we sort of just teased, just tell some people that they have to wear a mask and you can watch tempers flare. So as we see these COVID metrics continue to rise, the question becomes, will you have to wear one of these inside in LA County in the coming weeks?
Some people are like over it.
Probably same as last time. No, we don't want to. Don't tell us what to do.
These reactions could be what the LA County Health Department will face if they try to impose another mask mandate, even if it's to protect people.
It's a good idea either way because there's a lot of people who are sick.
Just to be on the safe side, why not? Like, everyone's getting sick again right now. It's just safe.
Thursday, LA County's health director, Dr. Barbara Ferrer, faced a barrage of questions about a new mandate. Ferrer said this.
We all need to wear our masks now.
But that's just a recommendation for now. The two metrics Ferrer says used to trigger a mandate are 2 consecutive weeks of high COVID transmission as defined by the CDC and COVID hospitalizations hitting 10% of bed capacity also for 2 weeks.
We haven't reached that super dangerous threshold where CDC has said, you really need to start worrying about your hospital system.
Ferrer says new data has her optimistic about not imposing a mandate, but the door is still open. She faces stiff opposition, not just from some in the public, but also from a powerful LA County supervisor.
Mandating will have the opposite effect. People know what they need to do. The reality is, who is going to enforce it? We saw during the Super Bowl when no one was complying with the mask mandate. There was no enforcement.
Doctors are even calling out the metrics being used. Dr. Michael Daigneault works in the emergency room at Providence St. Joseph Medical Center. He says COVID hospitalization numbers can be deceiving because all patients admitted are being tested for COVID, even if they're not being treated for it.
People have to understand the context of when you see increased hospitalization numbers, it doesn't mean that these patients are being admitted for severe COVID, and it doesn't mean that we are being overwhelmed with COVID patients. We're focusing on the other reasons that they're in the hospital: a broken hip, a heart attack, a stroke.
Dr. Daigneault and a slew of other top doctors across the country and here in LA recommend that you get vaccinated. That's the best way to avoid the hospital. Get those boosters, including the latest booster that helps battle the Omicron variant. Reporting live in Porter Ranch, I'm Tom Waite, KCAL 9 News.
Well, Tom's out there. It is cold. It's dry tonight.